Hello, hello. Welcome back, technologists. Welcome back to the podcast. So, in today's episode, I wanted to talk about feedback, continuous improvement, and just embracing constructive criticism when we are in CT, learning CT, and just trying to be the best technologist that we can. So, I think that feedback, improvement, constructive criticism are all pieces that as technologists we need so that we can improve our skills, we can enhance our skills, and we can work on things that we can improve on because we all know everybody has something that they can work on. There's always something to work on and something that can make you a better technologist. I think that sometimes we get lost in the shuffle when we are training new people, when we have new techs like from another facility learning what we do as a process in our facility. I think we get lost on feedback and how we can give constructive criticism so they can make improvements to just enhancing their skills on the job. Because what happens is when we don't give that constructive feedback, when we don't give them that constructive, positive criticism, there's no way for them to improve. They're just going to repeat the same mistakes over and over and over again. Paint this scenario for me, and for yourself. You have a technologist keeps repeating the same mistake. Okay. You tell them, hey, this is a mistake. You can't do this. But they keep repeating the same mistake, the same mistake. If you want them not to repeat the mistake, where is your feedback and positive constructive criticism come in? Because that's where we give them an opportunity to learn and give them an opportunity to improve how they execute that exam. If they're constantly missing a bolus on a PE study, help them improve that. Like give them some positive feedback and some constructive feedback and saying, okay, I know you did this. This probably helped, but we missed the PE. Let me show you how to time this correctly. If they're not centering the patient correctly, like give them that positive feedback and that constructive criticism to say, okay, now in order to calculate the dose, because we all know them physicists are always after us about dose reduction, right? And radiation dose and making sure we line up those patients correctly, right? Make sure that you teach them how to do it the proper way. The one thing that new technologists, they won't repeat mistakes, okay? The same mistake, let me correct that. The same mistake is if you teach them how to do it correctly the first time. If you teach them how to correctly do it after they make the mistake, correctly how to execute that so they don't make the mistake next time. If you give them a platform or a just a way that they can voice, hey, I need help. Hey, I made this mistake. How do I correct it? I think that's another piece when it comes to us training new technologists and educating them is giving them a space, giving them a safe space that they can go ahead and just speak up when they don't understand something. They can speak up when they've made a mistake and they're not going to get criticized in a negative way and give them that just time and that ample, just give them that dual diligence to go ahead and just feel comfortable with expressing what they need help on, right? So I think giving them a safe space to be able to communicate with a technologist that's more senior, whether it's a manager, a supervisor, whatever the case is, radiologist, to give them that platform that they can be honest about this is what I'm struggling with. This is where I'm making this mistake. How do I correct this mistake? And give them that opportunity to ask questions when they don't understand something. And I think that is the biggest takeaway and something that as technologists and just as a modality as a whole that we need to improve on so that we can really pump out them good technologists and make sure they're successful, for years to come, whether they stay with us or they go to another facility. Because then if you have a good technologist, that executes good exams, knows what they're doing, and knows how to take care of the patients. It doesn't matter which hospital they go or what clinic they go to. They could just hop in that chair, say, okay, I need to learn what your policy and procedures is, what I can do, what I can't do. What is your limit on this? The different types of contraindications. What do we do for allergy prep? They could basically just sit and scan. And that is like ideal when it comes to any facility, any hospital that they want a technologist that can just sit and scan and just execute the work. So I think with giving them feedback so they can improve, give them that positive, constructive criticism, that is super important because how are they supposed to correct their mistakes if we don't give them that feedback and give them that opportunity to learn and to correct their mistake, right? Because that's what it's all about. Not, knocking them down negatively and saying, well, they're just not going to learn. They don't know what they're doing. No, it's up to you as the technologist, you the senior, to make sure that they know what they're doing, correct their mistakes, give them that positive reinforcement, and so they can really execute those good exams and feel good about themselves. They can feel confident that they can go in there and say, yes, I can do this. Isn't that what it's all about? Right? So I hope those takeaways were really insightful. And if you ever have any questions, shoot me a DM on Instagram, send me an email. I encourage questions, comments, feedback. I love it all. Stories. If you have any stories that you want to share, please send me an email and I will share it on a future episode. Or even if you want to come on the podcast, you can apply to come on the podcast. I will have a link to an application. So fill it out. You want to come on the show? Hey, I would love to have you. So I will have some guests on the show here in the near future. So if you would like to be a guest, come on the show and we can freaking chat, right? And I am here for all your CT needs. So if you need courses, something to get you going on the basics, make sure you check out the link in my show notes. Come get your CT learn on. Come learn all the basics that I have to offer. Okay. Don't struggle. Come learn. So hope this episode was super insightful for you, and I will chat with you guys next week.